hands off today. My name is Erica Saylor. I'm a research associate for the Douglas W. Pollock Center for Addiction Outreach and Research at Penn State Harrisburg. And I'm very happy today to be emceeing our webinar for Life Unites Us, Race and Recovery, Supporting Equity in Recovery and Treatment. So today, just go over a few housekeeping items, talk a little bit about the campaign, and then we will turn it over to our speakers. Our first speaker is Secretary Jen Smith from PA Department of Drug and Alcohol Programs, and then we also have Laurie Johnson-Wade from Lost Dreams Awakening. Then we'll go over some questions and we will wrap up for today. Just as a quick reminder, all participants in this webinar do have their audio and video features disabled. So if you would like to submit a question to either of our presenters, please put it in the Q&A box and we will go through all those questions at the end, like I mentioned. If you get disconnected from Zoom, retry the original link and we'll let you back in. If for some reason you have to hop off early or having technical issues, the webinar is being recorded and will be available to be accessed at a later point in time. So a little bit about the Life Unites Us campaign. Life Unites Us is a project developed to reduce stigma around opioid use disorder. This is done by using a people-forward approach that aims to connect individuals through stories. Through research and practice in anti-stigma work, we have found that connecting people through their stories and similarities can and will reduce stigma. In order to do this, the team records stories of community members across PA, stories of both personal recovery and as an ally to someone in recovery. These short stories are then produced and featured on the Life Unites Us website and social media. The intent is that by sharing stories of hope and resiliency, we can prove that recovery is probable, reducing stigma makes recovery more likely, addiction is treatable, those living with an addiction are just like everyone else, and those living with OUD are much more than their disease. As I mentioned in the last slide, this campaign can be found online. The website features a library of resources that are shared across social media platforms, and the website address is lifeunitesus.com. The campaign works alongside a variety of local partners that bring it to life. The aim is to provide a platform for voices from your community and a resource to add to the work of many you are already doing to end stigma. And the great news is that if you're not already involved, you can join us in ending stigma by following and sharing the campaign. If you're part of a larger organization or effort, we would love to invite you to become a partner with the Life Unites Us. Partners of the campaign have the opportunity to help recruit stories and share stories to and from your community. If you do engage as a partner, you will have the opportunity to have your logo included on the website, receive curated campaign videos tailored to your community, be invited to our monthly webinars and trainings like today, get access to exclusive partner resources, and have input on what types of webinars we do next. And if you're interested in becoming a partner, you can complete the form on the website or you can email my great colleague, Maddie Morales. Her email is right there on the screen and she's also gonna drop it in the chat box for everyone as well. So with all of that being said, we will move on to our speaker portion today. And I have the great pleasure of introducing Secretary Smith. Secretary Jen Smith was first appointed Secretary of DDAP in March 2018 and reappointed in April 2019 under Governor Wolf's second term. Since assuming the role of secretary, she has led the department's focus on strengthening Pennsylvania's drug and alcohol treatment landscape by increasing drug take-back opportunities, launching Pennsylvania's Get Help Now hotline, expanding access to naloxone in communities around Pennsylvania, and overseeing the distribution of more than $230 million in federal grant funding from the Substance Abuse and Mental Health Administration. Secretary Smith has led collaborations with the Pennsylvania Department of Health to release guidelines and protocols for warm handoffs that help overdose survivors transition into substance use disorder treatment and awarded Pennsylvania's coordinated medication-assisted treatment centers to expand access to medication-assisted treatment. During Governor Wolf's second term, Secretary Smith is leading DDAP's efforts to positively influence the knowledge and behavior around the topic of addiction. Areas of focus include placing a heavy focus on reducing stigma associated with substance use disorder, intensifying primary prevention efforts, strengthening treatment systems, and empowering sustained recovery. Secretary Smith.
Thank you, Erica. I appreciate that very, very lengthy introduction. I have to remind my staff to pare that down a little bit next time, maybe. Welcome, everyone. Thank you so much for joining the webinar, whether you're viewing and listening live or whether you're checking out the recording afterwards. I want to make really clear that I am just a really small opening act for the real main event. And I'm really excited for you to hear from Laurie Johnson-Wade. She's an amazing advocate, a wonderful person, and has been involved recently with some great initiatives that our department is working on. And I'll tell you a little bit about that in a couple of minutes. So I'll keep my remarks fairly brief so that we have lots of opportunity to hear from her. So I wanted to just take a few minutes to share with you the environment that has led to some of these discussions around racial equity and today's discussion around recovery. So I think we all can recognize that 2020 was a really different and difficult year for a lot of reasons, right? Pandemic is near the top of that list. But also topping the news were many stories about racial injustices. And I know it caused me personally to take a really hard look at what I believed about this issue and how I believed as a department that we could contribute to improving the situation. And so one of the ways that we are looking to improve is looking internally at our department and saying, how can we ensure that we are cultivating an environment where racial equity exists? And so internally, we have a work group made up of about a dozen volunteers from our agency with racial diversity as part of that volunteer work group. And we're using the appreciative inquiry approach to develop some goals around what we would like to accomplish as an agency. And some of the things that we're talking about include how do we recruit a racially diverse population, and as part of that recruitment effort, how do we ensure that there's equity within our hiring practices? And then we're looking at retention and promotion, and how do we ensure that there's racial diversity represented at all levels of us as an organization? It's a tough discussion, folks. You know, we're a very small agency. When you think about state government, you normally think of these really mammoth agencies with thousands of employees. DDAP has less than 100, so we're a relatively small organization, which means there are fewer opportunities in general at the management level. But it's a really important discussion to have when we look across leadership in the agency and see really predominantly white individuals. That's not necessarily a good thing. And because the population that we serve represents a much more diverse population, we need to represent that within our agency as well. So we've got some internal efforts around what we can do as an agency to improve racial equity. At the same time, we recognize that we also need to talk about this with our stakeholders. We need to talk about the drug and alcohol field and what does racial equity mean to the field, and how do we work towards making progress in that effort. So one of the areas that we've really started to build in discussions is within the recovery community space. So I'm very pleased to say that the woman you're going to hear from very shortly is one of the individuals that we asked to participate in our Recovery Rising project as an advisory commission member. And the purpose of Recovery Rising is for Pennsylvania to do some visioning around recovery supports in the state. I think over the past few years, there have been some fractured lines of communication. There have been some challenges around policy setting and funding opportunities. And I think we want to take this opportunity to say, what's past is past. We can't change what happened in the past, but let's all get together and really determine where we want to move forward in Pennsylvania, how we all can contribute to advancing recovery supports. And within this Recovery Rising project, there is a specific lens around racial equity, and particularly being inclusive of minority, in this case, Black populations. So it is my hope that through the first phase of this project, which will run through the beginning of July, we will leave that first phase with a healthy list of recommendations around what the state can start to work on to improve recovery support delivery in the state. And I certainly hope that some of those recommendations are specifically around improving services for our Black population. So there's some work being done. All of that said, I'm certainly not bragging. I'm certainly not indicating that those are the only two things that need to happen. I think it's a really good start, looking internally, starting to have some conversations with our stakeholder groups. But there is truly a tremendous amount of work to be done in this space in all aspects of the continuum. So be patient with us. We're working through a lot of these issues at different levels, really trying to infuse this discussion about race at every level and in every conversation. It takes time and it takes hard work. And I'm thankful to those of you that are on the call that are part of those conversations, that there is a willingness to have those really difficult conversations with us and to work together to create a vision for moving forward. I think that is so important. Really, that's what recovery is all about, right? It's hope. And I have hope that we can make progress in this space when we all work together. So thank you so much for tuning in. It is now my great pleasure to turn the microphone back over to Erica, who is going to introduce to you the real main event for today. Erica?
Thank you so much, Secretary Smith, for your overview, for your transparency, and really to continue this conversation and discussion moving forward. So now it is my great pleasure to introduce Laurie Johnson-Wade. Laurie is the co-founder of Lost Dreams Awakening Recovery Community Organization in New Kensington, PA. Laurie, along with her husband, Dr. Vonzel Wade, co-founded the Lost Dreams Awakening Recovery Center in 2014. Laurie is a 1993 graduate of Newport Business Institute with a degree in health administration. She's a certified behavioral specialist, a Pennsylvania Certification Board certified recovery specialist, and recovery support supervisor, a trainer of the CCAR Recovery Coach Academy and Ethical Considerations for Recovery Coaches, a trained forensic peer specialist, a trained facilitator of the Pennsylvania Family Support Alliance Recovering Families Program, a trainer of the ProActs Family Education Series, and an intern for the Arise Invitational Interventions and Continuing Care for Families. Laurie is also the founder of Lost Dreams Awakening Grandparents as Parents program and served on the governor's opioid task force for grandparents raising grandchildren due to substance use disorder. Laurie helped co-develop a strength-based peer recovery support workforce, specialized training and supervision program to assist the PRSW to help navigate COVID-19 and other crises. Laurie works tirelessly to help advance the peer recovery workforce in the state and beyond. Laurie was chosen as one of the 5 representatives invited to the national organization, Faces and Voices of Recovery, to meet with the acting drug czar at the Office of National Drug Control Policy in Washington, D.C., to discuss the importance of recovery support services. Laurie's passion is most definitely advocacy, and she's a staunch representative of recovery community locally, statewide, and nationally. She has been featured on various local, state, and national platforms and enjoys mentoring communities and establishing their own recovery community organizations. She serves on the National Membership Committee for the Association of Recovery Community Organizations and brings nearly 30 years of active lived recovery experience to the rewarding and revolutionary work of recovery support services and recovery coaching. Notably, Laurie was named 2020 Advocate of the Year by the Pittsburgh Recovery Walk. This award is bestowed upon an individual who has worked to change policy or public opinion about addiction and recovery. Laurie received the award and proclamation from the Pittsburgh City Council. And even most recently, Laurie was globally recognized as a recovery coach by the Recovery Coach Training Institute to participate on a national panel of recovery experts for Black Lives in Recovery, a National Recovery Month celebration. And she's also a proud member of the National Recovery Organization, Black Faces, Black Voices. And that is a ton of stuff. And you know that Laurie really is so involved in this work, and she is such a sweet and wonderful person. And I am really pleased to be able to turn it over to her to talk about our topic today. Laurie.
Thank you, Erica, for that introduction. I would like to thank Secretary Jennifer Smith for her leadership at DDAP and for having the fortitude to highlight our race and recovery conversation today. I would also like to thank Erica at Penn State and Maddie with Life Unites Us for being such great partners on today's presentation. Just a little bit about myself. I know that bio was long, but I wanted to just give you something you might not know about me. I am the great-great-great-granddaughter of slaves from the Wall Plantation at Culpeper, Virginia. I am working on my 30th year of recovery. I'm also a recovering family member. And one of the most encouraging truths you're going to hear from me today is that recovery and resiliency are real. I am living proof. So today's topic, race and recovery. If you see on the slide, you'll see this discussion of race and recovery is thorny, complex, and multifaceted. My first objective is to explore the construct of race and some of the various conceptual elements involved in that. Okay. So the U.S. Census Bureau often uses race to define somebody by their skin color and social and biological attributes. A person's self-identification with one or more social groups. These personal identifiers are the words you most often see when you're completing official paperwork. So you're asked to check a box of your respective race. When considering what the different types of races are, you'll usually see white, black, African American, Asian, American Indian, Alaskan, Native, Native Hawaiian, and other Pacific Islanders. Another definition from the Encyclopedia Britannica describes race as the idea that the human species is divided into distinct groups on the basis of inherited physical and behavioral differences. So worth noting in this second paragraph that genetic studies in the late 20th century refuted the existence of biogenetically distinct races, and scholars now argue that races are cultural interventions reflecting specific attitudes and beliefs that were imposed on different populations in the wake of Western European conquest beginning in the 15th century. So in other words, scientists believe that there is only one race, and that is the human race. So Dr. Jennifer Brody, who is the director for the Center for Comparative Studies in Race and Ethnicity at Stanford, states that the word race has a long history of being used to divide members of society, often based on superficial physical attributes. Her quote is, "For hundreds of years, race has been defined by ourselves, by the law, by scientists, and the government, often with competing interests as cultural norms change. We think we know someone's race when we see it, and it's really much more complicated and more powerful than that. They change over time. They have power, and when we claim them because they're about our lives, but they are also about our relationship with power. Some people want to exploit difference. And if you want to reclassify people, race is one way of having power over them. This is Dr. Brody at Stanford. Okay, the African American Behavioral Health Center of Excellence out of Morehouse College believes that the word race is a social and political construct invented long ago to justify an industry built on kidnapping, buying, selling, owning, and exploiting human beings. We have inherited a language that does not yet know how to communicate without wounding. When words are used in ways that deny the power, worth, or individuality of human beings, they tend to grow toxic. Searching carefully for more respectful language is not political correctness. It's an act of repair. I think that this definition put forth by the African American Behavioral Health Center of Excellence gives us a glimpse into the enormity of the lift that we face in deconstructing systemic and institutional isms around race. It's a big lift. So it's worth noting that there is a substantial body of work that has found that racial biases shape behavior, leading to barriers in housing, employment, healthcare, and access to financial resources for Black, Latinx, and other people of color. And I think you're going to see as we go further into this presentation that these things revolve around the 4 dimensions of wellness in recovery. So the evidence, data, statistics, studies are overwhelmingly clear that we have isms around race, and yet the denial of this fact, or I call it the unseeing eyes, is a great contributor to this ugly truth. The fact is that this is woven into every fabric of our nation, and recovery is no exception. So we are going to move into looking at scientists at the Centers for Disease Control and Prevention say that fatal drug overdoses nationwide surged roughly 20% during the pandemic, killing more than 83,000 people in 2020. A growing body of research suggests that Black Americans have suffered the heaviest toll. Let's take a listen. Okay.
Or, I was gonna say, we might have to skip it. I think maybe a setting isn't enabled to be able to play it through.
No worries at all. The gist of this clip, and it's going to be available in the slides as a link. I'll make sure that it gets into the chat box, is that very often when African Americans have substance use disorder and present for treatment, they often receive incarceration instead. Currently, the overdose death rate among African Americans is 50% higher than any other group. So these numbers are climbing, they're alarming. And so we need to keep a pulse on this because we know the progressive nature of addiction and it will continue. So this is happening right now. We're going to go on to what NIDA has to say about recovery. I want to get into some of the recovery definitions. see if we can get into our next slide. There we go. So the National Institute on Drug Abuse, NIDA, is the lead federal agency supporting scientific research on drug use and its consequences. I just wanted to, as a sidebar, tell you that the word abuse in drug and alcohol is an antiquated term in the recovery arena. And I had been under the listening voice of some of the leaders of these agencies. And it seems as though perhaps the cost to correct this language on a national level may be too high. And they are investing in people right now rather than in the change of language. But I just wanted to make sure that you knew that this is an advocacy item for our future. The good news, and I love moving into recovery, is that addiction is a treatable disorder. Research on the science of addiction and the treatment of substance use disorders has led to the development of research-based methods that help people to stop using drugs and resume productive lives. This is also known as being in recovery. And I think it's worth noting also with NIDA that they have made a commitment to do some internal work as well. They have made a public statement around their lack of studies on African Americans and the diversity within the institution, and they are committed to moving forward on their diversity, equity, and inclusion plans. Okay, so now we get in to SAMHSA, SAMHSA's definition. In August of 2010, leaders in the behavioral health field consisting of people in recovery from mental health and substance use problems and SAMHSA all met to explore the development of a common unified working definition of recovery. Prior to this, SAMHSA had separate definitions for recovery for mental disorders and substance use disorders. These different definitions, along with other government agency definitions, complicated the discussion as they worked to expand health insurance coverage for treatment and recovery support services. So building on these efforts and in consultation with many stakeholders, some of which may be on this webinar today, you may have participated in that process, SAMHSA developed a working definition and set of guiding principles for recovery and a standard unified working definition to help advance recovery opportunities for all Americans, to help clarify these recovery concepts for peers, families, funders, providers, and others. And they came up with this most up-to-date definition, which is our definition that we use most commonly today, that recovery is a process of change through which people improve their health and wellness, live self-directed lives, and strive to reach their full potential. So there are also 4 major dimensions, and in these 4 major dimensions, as we alluded to in the bodies of work that speak to the disparities in certain groups, particularly African Americans, there are glaring disparities among Black, Indigenous, people of color. These are the 4 dimensions: health, overcoming and managing one's disease or symptoms and making informed, healthy choices that support physical and emotional well-being. Home, having a stable and safe place to live. Purpose, conducting meaningful daily activities and having the independence, income, and resources to participate in society and community. Having relationships and social networks that provide support, friendship, love, and hope. So we could have a full webinar on this slide alone on the disparities that exist as it relates to race and recovery, but we're going to move on. Okay, so this is a brochure that you can access at SAMHSA's website. It's one that I use and train on, and believe that is an effective tool in looking at the 10 guiding principles of recovery. And so you can see on the clip art that hope, person-driven, many pathways, holistic, peer support, relational, culture, addressing trauma, strengths and responsibilities, and respect are the 10 guiding principles outlined by that working group that met in 2010 when they came up with the definition of recovery. But hope is the key principle. When in place, these principles build recovery capital, which is the depth and breadth of resources and support drawn upon by individuals, families, and communities. And hope, the belief that these challenges and conditions can be overcome, is the foundation of recovery. Secretary Smith spoke to this, that she's hopeful, and so am I. The process of recovery is highly personal and occurs via many pathways. Recovery is characterized by continual growth and improvement in one's health and wellness that may involve setbacks. So it's non-linear. Because setbacks are a natural part of life, resilience becomes a key component of recovery. So supporting recovery requires that mental health and addiction services be responsive and respectful to the health beliefs, practices, and cultural and linguistic needs of diverse peoples and groups, that they actively address diversity in the delivery of services. You know, very often we say, you know, one of the 10 guiding principles of recovery is that it's cultural, but I think many providers have paid that in lip service rather than in cultural services. And some of that just by virtue of the fact that they haven't had the tools necessary. I hope to equip you with some of that today. And we need to seek to reduce health disparities in access and outcomes. Recovery seeks to reduce health disparities in access, so getting people access, and then, of course, the outcomes. Okay. So we're going to look at some of the data. Okay, we're going to start to kind of look at some of the last 2 years from SAMHSA's annual National Survey on Drug Use and Health. And if you look at this slide, you will see that this study was done in 2018. The data was collected in 2018, and this was published in 2020. So this report summarizes key findings from the National Survey on Drug Use and Health for national indicators of substance use and mental health among people 12 years and older in the civilian non-institutionalized population of the United States. So looking at the heading, which is alarming in and of itself, despite consequences and disease burden, treatment gaps among African Americans remain vast. So I'm a word person, and I looked up some synonyms for vast: massive, huge, enormous, gigantic, immense. You get the idea. In 2018, of the African Americans with substance use disorders, 12 years and older, 88.7% got no treatment. According to SAMHSA, no treatment for substance use disorder is defined as not receiving treatment at any location, such as a hospital, inpatient, a rehabilitation facility, whether it's inpatient or outpatient, mental health center, emergency room, private doctor's office, self-help group, or prison or jail. 88.7% got no treatment as of 2018. And it gets worse. For those with substance use disorders and any mental illness, African Americans 18 years and older, 91% got no treatment. If you look under co-occurring AMI and SUD, 18 plus, the orange block, fourth over, 91% got no treatment. Alarm should be going off. Okay. So we're going to look at the fact that when you have a co-occurring substance use disorder, it is associated with suicidal thoughts, plans, and attempts among African American adults. As you can see in this slide, where there is no substance use disorder, suicide thoughts, plans, and attempts are drastically reduced. So if you have a substance use disorder, the likelihood of having these suicidal thoughts, plans, and attempts or accompany that. If you treat the addiction, the suicide rates also decrease. Okay, let's look at 2019. So in 2019, the survey on drug use and health for African Americans, the only improvement made was the time it took for them between collecting the data and publishing the report. That was the only progress made. Going on to mental and substance use disorders among African Americans has a high prevalence and a huge treatment gap. I didn't have to look up the synonyms from like I did with 2018 because they used the word huge. If you look here, those with only substance use disorders went up to 90% getting no treatment. African Americans with just substance use disorder, 12 years and older, 90% got no treatment. When I initially saw that, I thought I was seeing things, but I verified it. I looked it deeper into the report. That was up from 88.7 just the year before. Remember, according to SAMHSA, no treatment for substance use disorder is not receiving treatment at any location, such as a hospital, a rehab, mental health center, emergency room, doctor's office, self-help group, prison, or jail. And treatment gaps aren't the only problem. It continues to get worse. For African Americans with substance use disorder and any mental illness, 18 years and older, that number went up to 91.5%. Got no treatment. So it's important to note that SAMHSA recognizes a increased difference between this estimate and the estimate for adults with SUD is statistically significant at the 0.05 level. So that increase, while it went from 90% to 91.5, any 0.05 level is a statistically significant number. Okay. And of course, once again, you know, the suicidal thoughts, plans, and attempts increase as well. So SAMHSA, excuse me, has publicly recognized that this is a horrific issue. And this is ongoing. It's a deadly trend for African Americans. If this trend continues, it's going to be a blow to the entire nation, if not already. So responding to the urgent need for greater equity and effectiveness in behavioral health services for African Americans, the United States Department of Health and Human Services, Substance Abuse and Mental Health Services Administration, SAMHSA, has established a new national center, the African American Behavioral Health Center of Excellence, the AABHCOE. And there's a link there for you to reference that. Excuse me. Okay, so with all this extremely discouraging and alarming news, we must continue to hope. Hope is the only positive emotion that requires negativity or uncertainty to be activated. If we didn't have uncertainty about our future, there would be no need for hope. And I have to tell you, the African American community has to be one of the most hopeful populations right now. So embracing the principle of hope, the foundation of our recovery, we hold fast to the belief that these challenges and conditions can be overcome. The other alternative is too painful to even think about. And so we will continue to hope. Okay, so race and recovery requires resiliency. SAMHSA established recovery support service systems to promote partnering with people in recovery from mental and substance use disorders and their family members to guide the behavioral health systems, promote individual, program, and system level approaches that foster health and resiliency, including helping individuals with behavioral health needs be well, manage symptoms, and achieve and maintain abstinence, increase housing to support recovery, reduce barriers to employment, education, and other life goals. There go those 4 dimensions again, and secure necessary social supports in their chosen community. Now, these are complex issues that require multi-level interventions from individuals, programs, and system-level approaches that foster health and resilience. African Americans are experts on the African American experience. They must be included in this process. And remember the recovery mantra, there is nothing about us without us. Call the experts to the table. Okay, so we may say, what can I do as an organization? You know, what can I do as an individual in my systems to foster health and recovery for all Americans? As a recovering African-American woman and recovery advocate, I will continue this conversation long after this webinar. And most likely until I die. It's my life's work. I do it for posterity. There are practical tools that can start the change process. This slide gives you perhaps a starting place. This is one tool of many that is available. This is from the Annie E. Casey Foundation, and it's from their Race Matters series. So it helps you to do racial equity impact analysis. So if you need a starting place, this is one of the places that you can start is with their particular foundation. So a link has been provided, and this is a move towards progress. There are a couple of things that I want to leave with you before we go into Q&A. Remember that unintended, undetected racial inequities allow accumulating advantages for those in power and privilege, whites, while accumulating disadvantages for people of color. It's just a fact. This isn't a debate, there's evidence to support this. We must demand equitable distribution of resources for recovery for all. The current systems are clearly not serving the African American community in an equitable and measurable way. The only way to combat institutional isms around race is to be intentional in exposing it and mindful in creating equity for all. Racial inequality shows up everywhere, especially in our organizations and institutions. In many cases, it's not intentional, but it slips in through our unseeing eyes. So unseeing eyes is the thing that I would challenge you to explore when it's right in front of you and yet you still have unseeing eyes. We need leaders like Secretary Smith to say, you know what, as a state, we are going to move towards diversity, equity, and inclusion at the Department of Drug and Alcohol Programs. We need SAMHSA and NIDA and the warehouses for recovery support to say we're going to stop having unseeing eyes. So that is my piece on race and recovery. This conversation needs to continue way beyond today. As an advocate, I plan on keeping the conversation going. Please reach out to me at any time. Thank you.
Thank you so much, Laurie. It is really, really wonderful for us to have your expertise and knowledge to bring to everybody involved with this campaign. And thank you for the wonderful presentation. It was great. At this time, we will open it up for questions and answers. If you have a question, please go ahead and drop it in the Q&A feature and not the chat box. We'll go down through and answer those here in a minute. So I'll give everybody just a second to pop those in there and we will go down through. So we have a question from Jennifer. She didn't specify two hits two. So if either Secretary Smith or Laurie have any insight, please feel free. So she said, I'd like to know how race and recovery discussions are fostered and cultivated and nurtured among college students. I know that's not necessarily either of your areas of expertise, but if you have any insight on anything that's going on that you're involved with or aware of, that would be helpful.
I'll start. Oh, go ahead. You go ahead, Laurie.
Go ahead, Secretary. I yield to you.
Oh, I don't have a whole lot to add. I was just going to indicate that I think this is a great opportunity for a suggestion to bring to the Recovery Rising Advisory Commission in terms of recommendations to look at moving forward. So I've already made a note to add that, Laurie, to our shared file where we're sharing all kinds of recommendations and discussion topics. So I will definitely make sure to bring that up. I can tell you too that, you know, in addition to college students on our advisory commission, we have the principal for the nation's only faith-based recovery high school. Mm-hmm. So focused on students a little younger than college, but still students. And he's going to be contributing to our cause in terms of making sure that we're accounting for school age folks. So it was a great question that you asked. I don't have any answers for it. Laurie might, but I will definitely make sure that it gets back to the advisory commission.
Thank you. The excellent question. Jennifer, what my recommendation would be to advocate for this to be integrated into curriculums. So they brush over some of these things. I know sometimes it depends what your focus of study is. It could be more or less, but I think this is something as we dismantle some of the defective systems, that this would be something that could be integrated in curriculums at the college level. And I would dare say elementary up.
Everywhere, yeah.
Everywhere.
Great, thank you both. So we have another question here. How can we promote those who are not getting treatment into our treatment facilities?
Repeat the question, please.
Sure. How can we promote or maybe work with those who are not getting treatment into our facilities? So how, Laurie, like you mentioned, a lot of Black and communities of color are not getting into treatment, and there's a huge disparity there. How can someone work with them to get those folks who are not receiving treatment into care? I know you went over some great recommendations, but anything additional that you want to share there?
Well, exploring the reports on a deeper level, some of the reasons that African Americans don't make it to treatment is they become incarcerated. There's a long history of criminalizing addiction in the African American community. And so my recommendation would be to forge partnerships with criminal justice. So, a lot of the diversion courts, I know that there's a sophisticated way that they exclude certain people from participating in those specialty courts. And based on some of the, there really needs to be some adjustments made, but I would say, quite honestly and sadly, partnering with the criminal justice system at this time.
Yeah, I think we hear that is particularly true in terms of folks who are re-entering communities. So when it's time for release from the criminal justice system, a lot of challenges with folks who may have been receiving treatment behind the walls, but don't get connected to treatment prior to release. And so then the risk of relapse and starting that cycle all over again of entering, being engaged in addictive behaviors and then involvement with criminal justice, it kind of starts all over again. So we hear about it from a treatment perspective in terms of reentry, as well as reentry related to recovery supports. So we really need to do a better job of folks that get initiated onto treatment while they're behind the walls. Maybe they've completed a treatment program or they're stabilized on medication, perhaps, making sure that they have a true bona fide connection to recovery supports before they walk out the door. Not just handing them a list of, hey, here's some groups you could join, but really actively making it part of their discharge planning to ensure they've already had a meeting with those folks. They know when the first session is, they know where they're going, what they're doing. So I think there's a lot of pieces with intersection to the criminal justice system. Front end, while they're there, and then when they're getting ready for release. I think there's an awful lot of opportunity there.
Great, thank you both. We have another question here. How has the lack of affordability in housing impacted minority groups in recovery?
I said part of it is discriminatory housing practices more than affordability. I think that, and I know personally, I don't know too many African Americans who can't tell you stories around these things, but I know in early recovery when my husband and I went for housing, the place was available when we called, but when they saw us, somehow it magically became unavailable. And the only thing we could correlate it with was that we were Black, because we had just talked to them and we were going to see the place and we were going to, and really, quite frankly, they did us a favor because we ended up buying a house rather than renting a house. But I think discriminatory housing practices.
Doesn't look like we have any additional questions here, but I hope you guys have a chance before we hop off to look at the chat. You guys have gotten a lot of praise and great things coming through for all of your comments. Someone also commented about speaking the language of the communities, referencing generational poverty, food insecurities, high rates of unemployment. I know you kind of touched on that, Laurie, with the various dimensions of wellness. Yes. It says you also need to be present in these communities and speak their language and meet them where they are. And it also mentions about a lack of trust, and sometimes more immediate needs take precedence over recovery needs.
Erica, I'll just mention that in the NPR clip, one of the things that the young lady whose mother overdosed and died spoke to is that they are afraid to call for help for fear that, especially if you have children, they'll take my children. Or they look at past experiences where they've called for help for a family member and then they were arrested. So there is a lack of trust. We have so much work to do in so many different areas. It's an enormous lift. If I spent the rest of my life working on these issues, there would still be work left to do. That's how integrated it is in every fiber of what we do. So hope, hope, hope.
That's right. Yep. And thanks to folks like Laurie who bring a lot of stability to the field. They help keep us grounded and make sure that we don't forget the enormity of the task, but also that there really is hope, that there is progress that's being made. And, you know, we can't always focus on how daunting the task is. Sometimes we've got to look back over our shoulders and say, well, look how far we've come. Yeah, there's a really long road ahead, but we've also come a really long way, and that's important.
Yes, absolutely. Someone is snapping selfies with you guys through the Zoom chat, so I'm sure we'll Johnny, if you make sure you send those along, or you or anybody else snapping Zoom
Fab,
selfies,
right?
Yeah. So I know we're coming up on the hour here, so we will wrap things up for today. I really want to thank you, Laurie and Secretary Smith, for presenting today. You know, I think this is a great start to the conversation, and we hope to host more webinars on this topic, diving further in on the issue of race and recovery. So great presentation, and thank you both so much. And I hope everybody who attended learned a lot and has a lot of good things to do moving forward. Just as an FYI to everybody, there will, once you close out the window for Zoom, it'll automatically redirect you to a survey. If you wouldn't mind taking that to let us know how we did, what you liked, what you didn't like, what we can incorporate for next time, we would really appreciate that. And with that, I hope everybody has a wonderful rest of their day, and we will send out the recording, the slides, all of the things that we discussed today for everybody to utilize. Take care, everybody.
Thanks, Erica. Thank you, Laurie.
Thank you.
Thank you both.
Thank you all.